We think of the social determinants of health as the conditions in which people are born, grow, live, work, and age, and inequities in power, money, and resources that give rise to inequities in the conditions of daily life. Social determinants of health matter because they are the key drivers of health and health inequalities. When we think about health, commonly people think about health care. When you get sick, you need access to quality health care, but it's not lack of health care that leads to illness in the first place. It's the social determinants that drive the onset of illness, and then we need health care to deal with the illness once it's occurred. Look at the risk factors that people talk about for non-communicable disease: smoking, diet, alcohol, physical activity. All of those are socially determined. If you want people to not be overweight or obese, you could say, don't be overweight or obese. How useful do you think that would be? Not useful at all. Waste of breath. If you think that people should drink alcohol in moderation, you say, you should really drink alcohol in moderation. How useful would that be? Not useful at all. The drivers of those risk behaviors aren't simply lack of information. People aren't eating unhealthily or getting overweight or being physically inactive or smoking or drinking to excess through lack of knowledge. Social circumstances, having enough money, availability, there are a whole set of social drivers of those behaviors. So if you really want to get serious about non-communicable disease, you've got to look at causes such as those risk factors I've mentioned, but then you've got to look at the causes of the causes, the social determinants of those behaviors. And that goes from the beginning of life right through the life course. I think a declining economy is important for two reasons. The first is that although action on social determinants of health doesn't necessarily take new money, it does mean changing priorities. And it's difficult to change priorities when a government's feeling constrained. In fact, some of the investments we would be talking about, for example, investing in early child development, would be very good for the economy in the longer term. But in a declining economy, people aren't thinking of the longer term. They're thinking of right now, of making ends meet. And the second important feature of a declining economy is it dents optimism. It changes the national mood. Whereas if things are growing, you feel, we can do things. We've got a spirit of optimism and change. It means we need to work harder to counteract what could well be a sense of pessimism. When we began the WHO Commission on Social Determinants of Health, I said that if governments were not very caring or worse, then there was nothing we could do on social determinants of health. And colleagues of mine said, you're wrong. You've neglected the role of civil society, that we in civil society can do things government can't do, and we can hold government to account. We can get things on the agenda. And you look at all sorts of movements, civil rights, trade unions, the women's movement, universal suffrage, the environment. Civil society was involved in getting government to move on all these issues. So these were very important social changes, but they didn't start with government. They started with civil society. Why is there universal suffrage? Why do women have the vote? Not because some government ministers said, I think it'd be a good idea. It began because of the suffragette movement, the women's movement that says women should have the vote. So civil society has an absolutely crucial role to play. A more traditional approach is that health is the province of the Ministry of Health, and what ministries of health do primarily is manage the healthcare system. That's what they do. They might spend a little bit of money on prevention, but mainly ministries of health deal with health, and it's mainly healthcare. And there's been a big move globally on universal health coverage, very welcome, but it's all about healthcare. And social determinants of health is shifting the paradigm. It's saying we shouldn't be focusing only on healthcare, important as that is. Universal health coverage, wonderful, I applaud it, but we shouldn't be focusing only on making sure everyone gets access to care. We should be talking about the social determinants of health that determine whether and when people get sick in the first place. And to come back to non-communicable disease, in middle-income countries and high-income countries, overwhelmingly, non-communicable disease is the problem. In low-income countries, it's more or less equally balanced between communicable and non-communicable disease. And we're not going to make progress on NCD unless we make progress on social determinants of health. And that's very different from the more traditional biomedical approach, which says we can just do it through the healthcare system.